Assalamu alaikum. I hope you all are doing good. I'm here to discuss, as I had mentioned in my last video, the different kinds of mental health disorders and a little bit about what causes them as well. Now, before I start talking about these things, I would like all of you to keep in mind that I would not recommend you to self diagnose and start treating yourself in some way based off of what you see on Google or on the internet. I would recommend that if you see any of the symptoms that I mentioned in this video in yourself, you go to a doctor, discuss with them, and only when they prescribe anything to have in terms of medications or anything else, or they ask you to do certain things, only then should you start practicing them and try to get rid of any mental health disorder you have, if the doctor says so. So please keep that in mind when you watch this video. The purpose of this video is only to create some awareness about these issues and not to diagnose you or to encourage you to self-diagnose. Please note that the types of disorders that I'm going to mention in this video are not the only types of mental health disorders. These are just the very common ones, and it is just to give you an idea of how a variety of mental health disorders exist. So the first one we have here is anxiety disorder. Anxiety disorder, of course, there are different types of it as well. This is not just one hardcore thing. There are various kinds of it. But the main feature of this mental health disorder is that the person who has anxiety disorder experiences prolonged, time periods of being in fear and being restless and being scared and not at peace. They cannot, even if they try to calm down and feel at peace, just like other normal people who are mentally fine can. And there does not necessarily have to be a specific thing they point to and say, that is what is scaring me at this point. It could just be out of nowhere and they would start panicking and they could start sweating and their heartbeat can increase and things like that can happen. So it's basically a lot of fear and a lot of restlessness and things that go with that basically are a good description of what anxiety disorder is. The second most common one that we have is depression. The word depression is used a lot, and I'm not sure if everyone who uses it knows what it really means, but it is used a lot, and unfortunately it is very common. Now, the main feature of depression is that it is prolonged periods of sadness that you cannot seem to take yourself out of. We have such experiences in life that make us sad, definitely, but normally we get out of that somehow. We might experience a loss or we might fail at something or something like that, and you get sad. That's a normal reaction to it. But if it stays for longer than normal periods and you just cannot seem to get yourself out there and it keeps draining you, it keeps affecting your daily life activities, then maybe you might have depression. And what type, that the doctor can decide best, but there are chances that you might be suffering from depression. So if you do have this feeling of very prolonged sadness that you have been dealing with for a very long time and you just can't seem to get out of it, I recommend that you go to a doctor and get yourself checked, because the doctor can tell you best what you could do to get out of it. There are also various mood disorders. These disorders basically affect how you behave, your moods, and how you feel. There are a lot of people who have mood swings and things like that we experience, but mood disorders are more than just mood swings. They're not just you feeling good now and you feeling sad later on and then you're like, oh, I have a mood disorder. It doesn't work like that. But it is a more extreme form of your mood changing and fluctuating. For instance, one mood disorder that is very common is bipolar disorder. Bipolar disorder is where you have, basically how the name suggests, two poles of where you stand. Either you're extremely happy and have a very elevated mood, or you're depressed and have very low moods. And both these time periods, they can extend from a few days to weeks, and then out of nowhere you just seem to jump from one to the other without any apparent reason, and you can't seem to control it in any way. So you might based on that, assume that you might have a mood disorder, but again, you have to go to a doctor to get it checked. But it's more than just a mood swing. It is prolonged periods of sadness where you just can't seem to get out of the sadness, and then prolonged periods of extreme excitement and happiness, and what they call mania or hypomania if it's a little lower than that, and mania if it's extreme elevated moods, where you can't seem to care about anything and you're just all over the place. Of course, this is very draining if you keep fluctuating between two extremes, so it's not a healthy way to live at all. So it's best to consult a doctor again and to get it checked if you think you fall in that category. The other very common form of mental health disorders are PTSD, post-traumatic stress disorders. Post-traumatic stress disorders have to do with the after effects of some kind of trauma that you have experienced in your life. It could be anything that has impacted you. It could be a car accident. It could be a dog biting you. It could be something very minute that has affected you. It doesn't have to be very big for others. Everyone processes things differently. So it may be something very small, but it may have left a huge impact on your mind, and you may not be able to get yourself out of it. And every time that thing is brought into any discussion, or you have a memory of it, a flashback of it, or you see that thing in front of you, you can have intense feelings of fear and being out of control and having to go through that again, or even lose control of yourself. People faint, different things happen to them. So PTSD has to do with trauma. That's the basic thing to know about it. And then you not being able to forget it and leave it behind and move on with your life. So if you think that something like that has happened to you and you feel like it has left a very deep impact on you, it's always safe to check with a doctor and see if you have PTSD and then get the required treatment for it. Another very common form of mental disorders are psychotic disorders. Psychotic disorders are where a person has lost complete touch with reality. These are the people that we call, in layman's terms, crazy, and different words that we use for them, which are not nice, of course, but that's unfortunately how our society refers to them and uses those words also as insults in our day-to-day life conversations when we are mad at someone, and that degrades the people that are actually going through things like that. But that's how things in the society are. So I guess maybe through some awareness people might change their behavior towards them, but that's how things currently are. Now these people have lost complete touch with reality. These people no doubt have to be helped by a doctor. Not all psychotic disorders can be treated, but there are some that can be. So it is not okay to just lose hope on them and be like, you know what, this person is completely a lost case and nothing can happen, and just let them be. That's not the right way to go about it. If you know someone who's going through that, please take them to a doctor and see if something can be done about it. Now, all these mental disorders that I mentioned, as I had mentioned in the beginning of the video, these are not the only types of mental disorders that exist, and the causes that I mentioned are not the only causes that are behind these mental disorders or the other ones. But these were just to give you an idea of how mental health disorders work and what kinds of them exist and what causes could there be. But there's one more cause that I didn't discuss yet, and there's a reason for that, because it is very much unfamiliar still in the society that we live in, is that mental health disorders can also be caused due to genetics, which means that it can be inherited. So if my parents had a mental health disorder that was not treated, or my grandparents did, or anyone in the family before me did, there are chances that I might have it. Or if I have one and it doesn't get treated, my kids might have it, or my grandkids. It can run in the family. So it's always good to get yourself treated if you can, so that you can hopefully prevent a whole generation from going through it, or someone in the generation from experiencing it again. This is something that is not very much talked about. A lot of times mental health disorders, we think that they're only caused by real life experiences around us, and we never take genetics into consideration. But I think this is an important piece of information to know, and if you have someone in the family who has experienced it and you are experiencing similar symptoms, it's always good to make sure and check with a doctor if somehow you might also be impacted through hereditary transfer of the illness or genetics, I guess. So this is all for today. Again, I would like to say that if you do feel like you can relate to any of the things that I mentioned, please do not self-diagnose. Go to a doctor, get it checked, go to your nearest general physician or psychologist or psychiatrist, whoever is available, and try to take professional guidance, because those are the people who know best how you should go about these things. In my next videos, I will try to talk about self-care a little bit and try to explore how, if medical help is not available, what we can do on our own to help ourselves before we actually get some professional help. And I hope that will help in some way for those of you who do not have access to doctors. So yes, until my next video, take care, and Allah Hafiz.